To you and welcome to the news on the network service of the NTA. We thank you for joining us. I am Lydia Ojije Ochi. The Nigeria Center for Disease Control has confirmed another 148 new cases of COVID-19 in Nigeria on the 5th of May at 11:40 p.m. Lagos has 43 cases, 32 in Kano, 14 in Zamfara, 10 in the FCT, 9 in Katsina, 7 in Taraba, and 6 in Borno and Ogun states respectively. Others are Oyo with 5 cases, 3 in Edo, Kaduna, and Bauchi respectively. Adamawa and Gombe have 2 new cases each, while Plateau, Sokoto, and Kebbi have 1 case each. With this update, confirmed cases of COVID-19 stands at 2,950 in Nigeria, 481 discharged, and death stands at 98. The federal government has approved a 2-month license fee waiver for terrestrial broadcast stations in the country. Information and Culture Minister Lai Mohammed announced this at a meeting with members of the Broadcasting Organization of Nigeria in Abuja. Anthony Forson was there.
The waiver, as approved by the federal government, the Information and Culture Minister said, is part of initiatives to serve as palliatives to cushion the effects of the hardship board members are going through in the face of the current pandemic.
I make bold to say that while board members have been hit very hard by the effects of the current pandemic, they are not alone. In fact, the entire creative industry, which also covers the broadcast industry, has been affected by the pandemic and has inflicted extensive damage on the economy of nations across the world.
To this end, the minister explained that a committee has been set up to look into the situation and advise government appropriately on the best way to mitigate the effects of the pandemic on the industry.
Therefore, there's no doubt that we need a collective and government-supported approach in dealing with the immediate short and long-term palliative and initiatives for the industry in order to mitigate the effect of the pandemic on the sector.
Vice Chairman Broadcasting Organizations of Nigeria, Godfrey Ohuabunwa, explained that the impact of COVID-19 pandemic has greatly affected the economy and way of life, creating platforms for nations to review their survival strategies.
While we appreciate the efforts of government in tackling the pandemic, we urge for government intervention so as to save the sector from imminent collapse arising from declining revenue.
Bond, however, used the opportunity to commend the Nigerian Center for Disease Control and all frontline workers in the fight against the pandemic. In Abuja, Anthony Forson, NTA News.
More enlightenment is still required to clear the doubt and myths about the coronavirus pandemic. This is the position of Gombe State Task Force on COVID-19 while briefing on the protest by patients at the isolation center in the state. Correspondent Emmanuel Akila has more.
People who tested positive for COVID-19 at the Kodom Isolation Center in Gombe State broke out of isolation to protest for what they call better care for one of them sick with injury. And they believe that they are not sick with COVID-19.
Dalilin da yasa kaga aka kashe hanya yau aka ce ba za a taba shiga ba.
We blocked the road because one of us is sick with cancer and we want her to be taken home.
A ce corona ne.
If we don't take action and she dies here, it may be alleged that she died of coronavirus. People from the community hosting the isolation center came out in large numbers to join the protesters. While some believe that COVID-19 is real, others say they don't. In its regular briefing to give update on the disease, Task Force on COVID-19 in Gombe State lamented the action of the people who tested positive for COVID-19 and the community who joined in the protest, describing the action as catastrophic.
People talk about democracy or whatever. This virus does not understand any of that.
We need to, improve on the level of, enlightenment.
At the time of this report, Gombe State has 101 confirmed positive cases of COVID-19. In Gombe, I am Emmanuel Akila, NTA News.
Joining me live from Gombe is the State Commissioner for Health, Dr. Ahmed Mohamed Ghana. Honorable Commissioner, sir, we thank you for joining us. Now, let's talk about the protests by COVID-19 patients in isolation center in Gombe, in your state. Please tell us more about the protest.
Well, it was an unfortunate incident that happened yesterday, that some of the confirmed COVID-19 confirmed cases came out and barricaded the road on the premise that one of the patients there, one of the occupants there, had a very smelly wound, and so they drew our attention, and we promptly went there, in a bid to evacuate that patient to a safer location. But of course, it deteriorated into, a kind of a skirmishes, and which we came to understand that it was kind of an orchestrated and mischievous, attempt by some of the disgruntled people there, for the obvious reason that they simply do not believe that COVID-19 is true, that it truly exists. So it's a very big, serious issue, because despite all the state government effort towards getting the state very prepared and the very massive, social and public enlightenment that we have embarked upon for the last 2 months, there's still a big chunk of our population that do not believe that this disease exists. They think the government is just concocting numbers, that we're just accumulating numbers and ultimately looking forward to get some money from the federal government. This is unfortunate, and I don't think it's going to be a positive thing, in the containment of COVID-19 across the entire federation.
Okay, Commissioner, sir, what is the situation right now?
Well, the situation is quite calm. We were able to evacuate that lady yesterday out of camp, and of course, based on the terms that we must take that lady to back to her base in Billy. Of course, we agreed, but then of course we took her straight to a health facility in Billy under the custody of the medical officer, and then of course the police and the traditional ruler, were all informed, and we're continuing to treat that lady. We'll continue to look at the issues, at the camp. But I think what is becoming very obvious is the fact that COVID-19 is not just a health issue. It is a social issue, a psychological issue, economic issue. It's a multifaceted, a multidimensional, problem and crisis that the whole world is facing. And I think we have to evolve, and re-strategize so that we address this, very multifaceted nature of the disease, such a way that we can, come to terms with the issue.
Okay, now, just finally, tell us what other measures have the state government put in place to contain the spread of COVID-19?
Well, the government is very, it has deployed all the arsenals within, our disposal in terms of making sure that all the isolation facilities are ready, and that, health facilities, the workers have been trained, they have been deployed, and they are already functioning. Security, apparatus across the entire state is working assiduously to ensure that, cases that are coming into Gombe State are, kind of checked. If you look at the numbers that we have in Gombe State, which as at the last time was 88 from NCDC, 100% of them were imported cases, mainly from Kano and then to some extent from the Lagos of Kano. And the effort of the state government is actually what has culminated into diagnosing these cases, even before they got into our community. And so if you look at Gombe State, it's relatively, in terms of, signs and symptoms of COVID-19 within the community, you can hardly find that because we've been able to pick these people at the earliest point, at the point of entry, and then we've been able to isolate them. And this is, active case search, which many states have not really been doing. And that's why you have such a high number in Gombe State. It's because the state government has been very proactive, because we've been able to check people, the influx of people that are coming into Gombe State, and we're able to isolate them. We're able to go on contact tracing, and that has basically, ensured that our community is still largely free of COVID-19. And you've not that, unlike what's happening, in places like Kano. One of the reasons why the Kano situation has gotten out of control is simply because they were not tested. And despite all the difficulties that we have here in Gombe, we are very far away from any testing laboratory. Every day we have to fly between Gombe, 600 kilometers from Abuja, to just take a sample. Even if it's just for that, we have to go every day, and then get this result back into Gombe. So every day we've been doing this. The state government, has been running helter-skelter to get NCDC to come and support us to have, a testing facility in Gombe. This has not really come to fruition. And if you look at Gombe, it has bounds with all the 5 other states in the northeast geopolitical. This is the place to have a laboratory, because people go into all this, it has to go, and a lot of the burden that the state government is shouldering, we're doing that at the instance of the other 5 states. And so this is clearly a justification that the federal government needs to step into Gombe before it becomes a disaster, in the northeast of region.
Honorable Commissioner, we thank you. It's good to know that the state is doing a lot to contain the spread of the virus. Thank you for sharing your thoughts with us on Nationwide.
Thank you very much.
Thank you. We had been talking with the Commissioner for Health of Gombe State, Dr. Ahmed Mohamed Ghana. Governor Abubakar Atiku Bagudu of Kebbi State has directed security agencies in collaboration with the state COVID-19 task force to quarantine persons coming into the state from all entry points and mandate the wearing of face masks at designated places in the state. The governor announced this while briefing newsmen shortly after a closed-door meeting with the State COVID-19 Task Force Committee in the state. Usman Abdullahi Shehu reports.
Governor Abubakar Atiku Bagudu said it has become necessary for government to continue to take stronger measures to checkmate the spread of the deadly virus in the state. The governor, who recalled the circumstances surrounding the first death of the COVID-19 victim in the state, said the disease was taken from Usmanu Danfodio University Teaching Hospital in Sokoto to the Federal Medical Center in Kebbi, where he was admitted under false pretense case by his people. The victim, according to Governor Bagudu, absconded the hospital and died at home after his sample was collected before taking him to a designated isolation center. The governor explained that 8 out of the 10 new cases in the state, as announced by the NCDC, were contacts made by the deceased.
This incident that just narrated that have led to these 8 positive cases illustrates how easy it is for innocent others to be exposed tragically and quite often in the line of duty by one failure or recklessness to adhere to all the advice that is being said.
Governor Atiku Bagudu similarly announced that the state government will distribute palliatives to all vulnerable persons to ease the hardship arising from the measures adopted. In Birnin Kebbi, Usman Abdullahi Shehu, NTA News.
Enforcement of face masks in Lagos State. Let's join Hingino in Lagos for more on Nationwide. Hingino, you're next.
Thank you, Lydia. The Lagos State NYSC has again supported the state government in the fight against COVID-19 by donating preventive kits and other palliatives to both government and residents of the state. Nosa Usula reports that the State Commissioner for Special Duties and Intergovernmental Relations, who received the preventive kits on behalf of the state government, urged them to continue to be good ambassadors of the nation.
Across the world, governments, private organizations, and philanthropists are contributing immensely to the battle against COVID-19. In Nigeria, as various individuals and organizations contribute their quota towards containing the spread of coronavirus, the National Youth Service Corps is playing a key role by donating locally made preventive kits to state governments across the country.
When they get this palliative from us, that they should also be encouraged to do this kind of thing whenever they have the opportunity to.
The commissioner noted that the proactiveness of the Corps members in supporting the state government in its fight against the spread of coronavirus is commendable.
Allow me to commend one more time the NYSC, especially our Corps members who again have done it. They did it before for the sanitizers and the hand wash and the gloves and so on. Now they've done it one more time.
NYSC coordinator Eddie Megwa said the Corps members' call to service brings out the passion in them towards supporting government.
They are not only here to teach, to train, to develop their community. They are also here to feel the way they are feeling in this pandemic period.
The Corps members also visited Ifako Ijayi, Agege and Oshodi Isolo areas of the state where palliative materials were freely distributed to the residents of the areas. In Lagos, Nusa, Usula, NTA News.
And few days after the partial relaxation of the lockdown, Adeola Komiakere reports on the level of compliance by Lagos residents with the use of face masks and the rules of social distancing.
Following President Muhammadu Buhari's nationwide broadcast on gradual ease of the 5-week lockdown to enable the gradual reopening of the economy, the Lagos state government announced a new set of strict guidelines that must be enforced to prevent a rise in new COVID-19 cases. The rules include the compulsory wearing of face masks and maintenance of social distancing, especially in public. It was observed that about 70% of people in public wore their face masks, although some had them under their chin or in their pockets.
I have. It's written here.
They pay me for here, that's why I come out and say, make I take breathe small.
It's not convenient for me in terms of breathing.
Meanwhile, street vendors hovered around selling their wares.
It is sealed before you can open it, and I don't allow people to test it until you buy it.
In terms of public mobility, the social distancing directive is being flouted as some commercial drivers convey more than 60% passenger capacity as instructed by Governor Sanwo-Olu.
People don't care about their life
because there's scarcity of vehicle right now.
Some passengers who spoke off camera called for enforcement in this regard as the drivers are placing their lives at risk. In Lagos, Adeola Komiakere, NTA News.
That's it from Lagos. It's now back to you, Lydia.
Many thanks, Hingino. We'll now join Mie Ogidi, and he's at Lugbe Market, and want to see what update he has for us on activities there. Mie, if you can hear me loud and clear, looks like the weather is changing. What's the situation there since the ease of lockdown?
Thank you, Lydia. Wednesday and Saturdays are the coronavirus-induced market days in the Federal Capital Territory. And this Wednesday is quite a special one because this is the first Wednesday after the partial opening of the Federal Capital Territory. We have been to some markets, some metropolitan markets like Wuse, Lugbe, and Otako. They complied with the directive. They opened from 8 a.m. to 3 p.m. And some measures were really taken. For instance, children below the age of 11 were not allowed into the market, and the aged were not also allowed into the market. And those that were allowed access to the market, they made it compulsory. You wear your face mask, and the temperature check was compulsory. So from there, we drove down to a mini market here anyway in Differe, in Lugbe, not at the heart of Abuja, but here is like it's free for all. No measure is taken. Face masks, if I may mark them, just 20 over 100 wearing of face mask in this market. And this fruit market here, they sell even live chickens and others. As you can see, even both the buyer and the seller, they are wearing nothing. And at this other side, you can see my friends, they're in the cluster, and social distancing is not in their dictionary. As you can see, as if they are in a club kind of. And obviously, the chairman of the market is also among the group, or I may say the cluster here. So let me hear from him. Why are your guys not wearing face masks?
My name is Adamu Usman. I'm chairman of Lugoi Fruit Market Association. I want to extend my special thanks to our president and the federal government.
You just tell us, why are your guys not wearing face masks?
I'm not too clear about the question.
No, why they wear this thing where you
okay. Some of them have it, some of them doesn't have it, because this rule started from last day before yesterday.
So how many times do you open this?
So we started opening from the day before yesterday, from 6 o'clock to 8 p.m. Is it a.m.? So, but before, for a week, we are opening at 3 daily, from 10:30 to 2 afternoon, so that we are closing it.
But the government said that you open market 2 times a day. So what? Okay, so I think that is the much we can take from here. So, leader, it's back to you. You can see this is a different world. Thank you very much.
All right, Amir, before you leave there, you should at least teach him how to wear the face mask properly. We'll now take a break for... Okay, we'll now take a COVID-19 update. We'll join them live, the PTF briefing. Let's join them live now.
As the Minister of Aviation, the Minister of Humanitarian Affairs, Disaster Management and Social Development, and an update from the Honorable Minister of Information and Culture before we take your questions. I now invite the Secretary to Government of the Federation and Chairman of the PTF to please make his remarks.
Like this and expect a different result. Thank you.
Thank you very much, the SGF. We have come to the end of today's national briefing. It is true that we cannot go on like this and expect a different result. That's message number one. We must imbibe self-discipline. Message number two is always there. Please wear a mask or a covering when in public space. Observe all the protocols totally. Message number three is that we urge all Nigerians to also use this period of the pandemic to build social solidarity by eschewing stigmatization, support the mental well-being of our compatriots that are infected, continue to provide for the poor, the sick, the aged, and the vulnerable, and render whatever help you can at all times. Finally, please do not go into hiding if you suspect any infection or feel the symptoms. Go out, seek help from the appropriate medical facilities. Do not practice self-medication. It is in your interest and it is in the interest of your loved ones. I thank you very much. God bless Nigeria. We hope to see you tomorrow by the grace of God.
That was the PTF briefing on COVID-19. We're going to continue with Nationwide in about now. After the initial disinfection of public places, the Federal Ministry of Environment has issued certificate of decontamination to ministries and agencies of government, as well as private organizations in the Federal Capital Territory. Onengie Fine Face reports that the certification requires substance of health, social distancing, and other protocols to prevent contamination of the certified locations.
The washing of hands, the social distancing, and everything else, and keeping track of people that will be visiting that premises, and also keeping track of anybody that may exhibit symptoms of COVID-19 within that premises.
The Nigerian Television Authority NTA headquarters is among the certified locations in Abuja. The Northeast Development Commission has donated 2 ambulances, medical equipment and food items to Taraba State government to mitigate impact of COVID-19. Joseph Zana Gambo has details.
Presenting the keys of the 2 ambulances to the Taraba State Deputy Governor Haruna Manu, the team leader of the Northeast Development Commission, Yarima Mohammed Joshua, said the items, when put into use, are expected to mitigate the impact of COVID-19 in the state.
We have earlier promised that when we are bringing the ambulances, we are going to give you 50 beds. Unfortunately, now they are out of stocks, but we promise. Then in their place, we bring 200 apparatus, thermometer, for testing of temperature.
Other items donated include 200 packs of infrared thermometer for testing of temperature. The State Deputy Governor Haruna Manu, who received the items on behalf of the state governor, commended the federal government for the measures adopted so far to curb the spread of the coronavirus pandemic in the country. The deputy governor assured that the items will be judiciously used for the purpose intended.
Already we have 2 isolation facilities, and the governor directed that the ambulances should be deployed to those isolation centers that we have here in Taraba State.
The Northeast Development Commission had earlier donated food items to the state government. In Jalingo, Joseph Zanagambo, NTA News.
Mitaire Ikpeng is still at the venue of the PTF briefing for COVID-19, and he will give us highlights of the briefing. Mitaire, give us an overview briefly on the briefing.
Major highlight of today's briefing is that the Presidential Task Force has extended the ban on all flights, whether local or international, for the next 4 weeks. And this is despite easing the lockdown on Nigerians. And also the Presidential Task Force today continues to express concern over the total disregard of its guidelines and its guidelines by Nigerians. And it says this is worrisome, and it continues to appeal to Nigerians to take cognizance of these guidelines, and appeals to religious and traditional rulers to step in to create more awareness among Nigerians on the coronavirus pandemic and also on compliance of these guidelines. I have joining me at this time the National Coordinator of the Presidential Task Force, Dr. Sani Aliyu, who will throw more light on why there is disregard for these guidelines. Dr. Aliyu, is it the disregard for the guidelines, is it an issue of orientation or an issue of enforcement?
I think it's more to do with awareness of risk, perception of risk. As you know, coronavirus is not something that if you come out of your house, you will meet it, you will see it, and therefore you'll be afraid. It's a hidden enemy. And in a way, it's very difficult to change people's behavior just like that. I think what we need to do is to continue to push for more and more awareness campaigns across the country to let people know that really this illness is serious. It's a very serious issue. It kills, especially if you fall within the risk groups that we've always talked about. And even if you don't fall within the risk group, you could end up carrying this to your loved ones that could end up getting infected and getting extremely sick. We've seen what is going on in other parts of the world, where people are dying. There are countries that have had more than 1,000 deaths every day from COVID infection. And even here in Nigeria, we have almost about 100 people that have died from COVID infection. So it's certainly not a joke. It's something that we need to make sure that we comply with the guidelines. One of the reasons why we lifted or we eased the lockdown was partly because of our expectation based on modeling studies that if we continue to apply those guidelines consistently, because when I say wear a mask, wash your hands, sanitize your hands, keep a safe distance, no interstate travel, etc. We need those bits, those elements delivered together rather than choosing one and leaving the other.
Okay, thank you very much. So that's it from here. The message is that the coronavirus pandemic is not a joke and that Nigerians should stick to the guidelines released by the Presidential Task Force. It's back to the studio.
Thanks, Mitari, for that overview. The Ministry of Foreign Affairs says the federal government has commenced the process of evacuating willing Nigerian nationals outside the country in accordance with global best practices and guidelines by the Federal Ministry of Health and the Nigeria Center for Disease Control, NCDC. In a statement, the spokesperson of the ministry, Ferdinand Nwonyi, explained that the evacuees on arrival in Nigeria will undergo a mandatory 14-day supervised quarantine in a monitored environment. The scheduled evacuation of the first batch of 265 Nigerians from Dubai, United Arab Emirates, will be conducted by Emirates Airline, and the evacuees are expected to arrive Murtala Mohammed International Airport, Ikeja, and Lagos on Wednesday, 6th of May 2020 at 3 p.m. The ministry wishes to further inform that adequate arrangements for hotel accommodation in Lagos and Abuja have been made for the evacuation exercise. The selected hotels have been inspected and certified by the Port Health Services, Nigerian Civil Aviation Authority, Nigeria Center for Disease Control, Office of the National Security Advisor, and Ministry of Foreign Affairs. Furthermore, discussions are ongoing with British Airways through the British High Commission in Nigeria to evacuate about 300 Nigerians from London on Friday, 8 May 2020. The British Airways flight 9155 will depart London Heathrow Airport, Terminal 5 at 7:10 a.m. and arrive Lagos at 10 minutes after 1, same day. Additional arrangements are equally being made with Ethiopian Airlines to facilitate the evacuation of another batch of evacuees from New York to Abuja on Monday, the 11th of May 2020. The federal government wishes to reassure Nigerians of its unwavering commitment to ensuring the welfare and safety of all citizens. Zinret is standing by to give us update on violators of inter-border closure in Jos. It's over to you.
Thank you, Lydia. Good evening and welcome to Jos. As Plateau State enters another phase of lockdown, the new Commissioner of Police in the state, Edward Egbuka, has commended the people for complying with the call to check the COVID-19 pandemic. This came after the assessment tour of the Jos metropolis by the Commissioner and members of the enforcement team. Caleb Guchin reports.
The Plateau State Police Commissioner's tour of Jos Bukru Metropolis, being his first, is incidentally coming on the heels of the COVID-19 pandemic, which necessitated the lockdown placed on most states of Nigeria. In all areas visited, the call for people to stay home would be seen to have received the expected desire as the roads were virtually deserted.
To refresh the memory of the good people of Plateau State and commuters within the state. Our state boundaries have been closed. Intra-local government boundaries have been closed. This is for the safety of all. I would also like to add that the law enforcement agencies or agents on ground have been warned to be polite but firm in enforcing this all-important national assignment.
Mr. Egbuka also reiterated the need for understanding among the citizens and law enforcing agencies.
In line with the Inspector General of Police observation and directives, we will not tolerate, I repeat, we will not tolerate assault or harassment of any of the officers enforcing this duty. In the same line, the officers have been cautioned to shun corruption, shun being high-handed, particularly at the boundary areas.
The CP assured that efforts are also being intensified to ensure compliance in the rural areas. In Jos, Caleb Gochin, NTN News.
That's it from Jos. Lydia, it's back to you.
Many thanks, Zinret. A community in the FCT wants the federal government to include non-governmental organizations in sharing COVID-19 palliatives in the country. Residents of Waru, a suburb of the FCT who benefited from the free distribution of palliatives by Hope Alive Ladies Ministries International, made recommendations while commending the gesture. Many in the community who received the items were full of gratitude.
Tell them that anywhere they are going, let them use the face mask.
It will help my children because this lockup is really bring people down. So it's not even the COVID-19 that is killing people now, it's hunger.
Yes, the NGO should promote more and more on his own effort. Actually, we didn't plan for this. We don't have the capacity to plan for such a crowd. But when we came, because of the situation in the country, one will not be surprised again. NGOs will work with the rural people. We go to many places that it might be difficult for government to really reach down to those people. If government can incorporate NGOs in sharing the palliative, I think it will do a great help to.
Let's now join Obehi in Benin for more reports on Nationwide. Obehi.
Lydia, thank you for joining us in Benin. Different strategies have been initiated by government to fight the spread of the dreaded coronavirus pandemic, one of which is the interstate boundary restriction. Following this development, here is a situation report from different boundaries linking Edo State to other parts of the country.
At Ewonogbon in Abia Southwest local government area, which demarcates Edo and Ondo states, it was observed that security operatives were conducting checks on motorists to ensure that only those eligible cross the boundary.
Police is checking everybody. It's good, very nice. I like it.
Coming from Lagos, because of the announcement that the lockdown has been lifted up partially from Monday, just to meet situation like this, they have to give us chance to go back to our various states to start work.
The situation at Edo Delta boundaries by Ogan and Alice Kebbi was such that travelers, especially trucks conveying essential items, were allowed access after washing their hands and undergoing the temperature checking routines. Same went for those on essential duties. Defaulters on compulsory use of face masks and other offenders were dealt with accordingly. The level of compliance with interstate movement order on the Benin-Okene Highway, serving as boundary between Edo and Kogi State, was basically non-existent, as travelers had a free movement without restriction or security check.
I know here what did happen, but Buhari say make everybody just come down, make it a lockdown.
We must not stay at home like that. Now somebody must eat.
The state government has, however, deployed health officials to a screening center close to the Benin-Okene boundary to check every traveler coming into the state.
Yeah. Good evening.
Thank you, Behi. More communities in Umuahia receive palliatives. Chinenye will tell us more about it from Enugu.
Thank you, Lydia. Good evening and welcome to Enugu. Residents of Umuahia, the Abia state capital, say the continuous extension of the lockdown order to contain the spread of COVID-19 by the state government is beginning to take a heavy toll on them as they cry out for more palliative. Ifeoma Koli has a situation report.
The lockdown in Umuahia, the Abia state capital, has been in force for 5 weeks now, while total boundary closure is in its second week. This, no doubt, is taking its toll on the people, most of whom are traders and artisans that depend on daily income for survival. Residents say they are willing to comply with the order, but are calling for improved assistance from the government.
So the government should look for a way that they can help us.
Apart from the palliatives given by the state government through religious and community leaders, some notable individuals in Abia State have heeded to the cries of the people by distributing bags of rice and money to various communities to help cushion the effect of the prolonged lockdown.
It's not even about being vulnerable or not being vulnerable. Even the rich are crying because all businesses are shut. You know, people have been eating the money they got maybe since 2 months ago.
Attempts by the state government to relax the lockdown has aroused fear in some quarters, especially as the 2 index cases have been successfully cured with no other case so far.
I'm afraid because we in this part of the world have not in our nature learned how to distance.
Abians are optimistic that the pandemic will soon be a thing of the past if only people will abide by the NDDC and government guidelines. In Umuahia, Ifeoma Ndu-Okoli, NTA News.
And that is it from here. Lydia is back to you in Abuja for more on Nationwide.
Thank you, Chinenye, and that concludes Nationwide. Thank you for being a part of it. I am Lydia Ojiji Ochi. Have a pleasant evening. Bye.
Whose trawler caught fire in the Lagos axis. The Defense Headquarters appealed for regular intelligence report to enhance proactive response to security threats across the country. In Abuja, Ismail Musa, NTA News.
That's it on the news. Thanks for staying with us. I'm Ruth Aguela. Bye.